عليكم ورحمة الله تعالى وبركاته. My name is Khaled Hassan Ibrahim. Today we are going to talk about the thoracic region. First, we will start by the osteology of the thorax. Then we will move to the thoracic wall. Then we will move to the thoracic cavity and the internal viscera of the thorax. First, we will start by the osteology. This is thoracic regions extended from the neck to the level of the diaphragm, the costal cartilage. In the osteology of the thorax, anteriorly we have this region, this part which called the sternum. Sternum is subdivided into three parts. This part is called the manubrium, and this part of the sternum is called the body, and this part is called the xiphoid process. So we have manubrium, superiorly, we have the body, and we have the xiphoid process. The sternum is one of the flat bones, There are a lot of joints or two joints in the sternal regions between the manubrium and the sternum, the body, sternal body. This joint is called the manubriosternal joint. Type of this joint. What is the type of this joint? The secondary cartilaginous joint. Also, we have joint here between the body and the sternum, and the xiphoid process is called xiphoid joint. Also, the type of this joint is secondary cartilaginous joint. So this is sternum. Also, in the manubrium, we have the area here is called superior or sternal or jugular notch. We have a lot of articulations. The manubrium is articulate with the first rib, and part of the second rib is articulate with the manubrium. Also, the second rib is articulate with part of the manubrium and part of the body of the sternum. In the anterior lateral aspect of the thorax or thoracic wall, we have the ribs. Between the ribs and the sternum, we have which called the costal cartilages. تضاريس الضلعية هي الcostal cartilages. Posteriorly, in the thorax, we have vertebral column and we have thoracic vertebrae. The number of thoracic vertebrae are 12 in number. First, second, till the 12 thoracic vertebrae. So, in the thoracic wall, we have again sternum anteriorly, body, manubrium, body, xiphoid process. We have ribs anterior laterally. We have thoracic vertebra posteriorly. Let's move to the joints of the thoracic wall. We have a lot of joints in the thoracic or osteology of the thorax. We talk about the joints that are found in the midline. We have joint between the first rib and the manubrium. This joint, what is the type of this joint? The primary cartilaginous joint. Primary cartilaginous joint. The rest of joints between the ribs and the manubrium are synovial joint. This joint is called costochondral joint. Costochondral joint. The costochondral joint is a cartilaginous joint. Cartilaginous joint. Between the costal cartilages, we have interchondral joints. The type of interchondral joints are synovial in nature. Synovial in nature. Again, we have primary cartilaginous in the first rib. We have secondary cartilaginous in the midline. We have synovial joints between the seconds and other ribs. We have cartilaginous joint. We have synovial joints in the interchondral regions. Posteriorly, the ribs has many parts. It has a shaft, it has tubercle, has neck and head. The tubercle of the ribs is articulate with the transverse process, forming the joint called costotransverse joint. What is the type of this joint? The synovial in nature. The head of the ribs is articulate with the corresponding vertebra and the vertebra above. For example, the fifth ribs is articulate with the body of the fifth vertebra and the body of the fourth vertebra. Also, this joint is synovial in nature. So, posteriorly, we have costotransverse joint and costovertebral joint. Both of them are synovial in nature. Also, we have the joint between the vertebrae, thoracic vertebrae. The type of joint is secondary cartilaginous joint because it's found in the midline. What are the differences, or what is the differences between primary and secondary? Is the primary joint, cartilaginous joint, the type of cartilage is hyaline cartilage, as the type of cartilage is the secondary cartilaginous is fibrocartilage. So that is all about the osteology of the thoracic wall. Between the manubrium and the sternum, we have angle. This angle is called angle of Lewis or sternal angle. At the level of this angle, many features or many structures cross the other line, enter, one of them begin and one of them will end. So what are the structures, or what are the structure, or what are the occasions that happen behind the sternal angle? We have a lot of things occurs at this level. الحاجات اللي عندنا شنو تحصل في الليفل بتاع الستيرال انجل. اول حاجه هي في which vertebral level بين كم وكم او intervertebral disc. Here between T4 and T5, between T4 and T5 الانجل اوف لويس or الستيرنال انجل. في the level of the angle of Lewis, the trachea will bifurcate into two main bronchi. At the level of the sternal angle, the arch of the aorta will begin and it will end. The descending aorta will start. The thoracic duct will cross toward the opposite side. The azygous veins will enter the superior vena cava. In addition to that, there are many things occur behind the level of the sternal angle. Also, in the sternal angle, from the sternal angle, we can count the ribs and we can count the intercostal space. Regarding the sternum, clinical correlations regarding the sternum, the site of bone marrow biopsy, because it's located superficially and it's called an flat bone. That is all regarding the osteology of the thoracic wall. Any question regarding the osteology of the thorax? In the ribs, in the inner surface, the inner inferior surface of the ribs or rib, we have which called the subcostal groove. Subcostal groove is the area for neurovascular bundles, for vessels, artery, nerve, and vein. Also, regarding the arrangement of subcostal or intercostal vessels, what are the arrangement of intercostal or neurovascular bundles is subcostal groove. يعني الستركشر الاولى اللي جات هيك شنو؟ نلقى اول حاجه بنلقى الارتري عشان كده هو دائما عنده هاي ريسك انه يحصل فيه انجريشن. بيزور الجراح او الطبيب بتاع اليار او غيره لما يجي when he want to insert the chest vein اكثر حاجه يحصل لها انجري اللي هو intercostal arteries higher up. عندنا بيكون عندنا الفينز وعندنا النيرف. Regarding the ribs, we have true ribs, we have false ribs. Also, we have typical ribs, we have atypical ribs. Regarding the ribs, we have true ribs and false ribs. As we mentioned, the true ribs are first, second, till the seventh. Why they are true? Because they are connected directly to the sternum. 8, 9, 10, and others are connected either indirectly to the 7 ribs or 7 costal cartilage, or they are not connected at all. For example, 11 and 12 ribs, which called the floating ribs. So the true ribs from first to 7, the rest of ribs are false in nature. Regarding the typical ribs contains head, neck, 2 articular demi facets, subcostal groove, shaft, angle, and other part of the ribs. First rib is atypical. Second ribs, some references, is atypical. 10 ribs is atypical. 12 and 11 floating ribs are atypical. In the thoracic wall, again, we have the sternum anteriorly, manubrium, body of the sternum, xiphoid process, costal cartilages, and the ribs. The ribs located anterolaterally. Posteriorly, we have the 12 thoracic vertebrae. The joint between the manubrium and sternum is the manubriosternal joint. The joint between the body and the xiphoid process is the xiphoid joint. Both of them are secondary cartilaginous. The joint between the first rib and the manubrium is primary. The joint between second and upper is the synovial. The joint between the costal cartilage and ribs, costochondral cartilaginous. The interchondral joints are the synovial joint. Posteriorly, we will have the thoracic vertebrae, which is 12 in number, from the face to the 12 thoracic vertebra. In any thoracic vertebrae, we have the spinous process projected posteriorly and downward. We have the spinous transverse processes. The area between the spinous process and the transverse process is called the lamina, the space or the part from the vertebra between the transverse process and the body is called the pedicle. So we have transverse process, spinous process, transverse process, lamina, pedicle, and body anteriorly. The joint between any vertebra and other vertebra is secondary cartilaginous joint. The joint between the tubercle and the transverse process is called costotransverse. It's a synovial inside. The joint between the head and the body corresponding vertebra and vertebra above is called costovertebral joint, is also synovial in its type. In the first session, we talked about the osteology of the thorax. Let's move to the thoracic wall. This is a rib, and this is a rib. Between the two ribs, we have intercostal space or intercostal spaces. In the intercostal spaces, we have the intercostal muscles. From the outer part, the outer one is called external intercostal muscles. Below the external, we have internal intercostal muscles. Inside the thoracic wall, we have the innermost. Regarding the external intercostal muscles, the direction of fiber is very important to determine which of which. The direction of fibers is directed downward and medially or forward. Like the person put the hands in the pocket. The direction of fibers is directed downward and medially or forward. These external intercostal muscles. The external intercostal muscles is very important in the process of inspiration, important in process of inspiration. Muscle of inspiration. The other muscles, the internal and the innermost, are the muscles of expiration. So here we will find the external. This fibers is directed downward and backward. So this is not the external intercostal muscles. The external intercostal muscles is direction of fibers is directed downward and forward. Also, in the thoracic wall, we have these muscles, which this is the serratus anterior. Serratus anterior, located laterally or in the lateral chest wall. The serratus anteriorly. Inside the chest, we will find the innermost muscles. Also, we have a lot of muscles in the inner side of the thorax. For example, this muscle. What is the name of this muscle? This is transverse thoracic muscles. Also, here we will find the muscle called subcostalis. Subcostalis, transverse thoracic, and the innermost. All of them are muscles found in the inner aspect of the thoracic wall. Again, this is a rib, this is a rib, this is the intercostal space, this is the intercostal muscles or the wall, this is the innermost, this is transverse thoracic. Here we will find subcostalis. In the real cadaveric specimen, this is a rib, and this is a rib, this is an intercostal space, and this is intercostal muscles. This is the superior aspect, this is the inferior aspect, this is the costal margin, this is the costal margin. Here, this is the sternum, the body of the sternum, and here we have the xiphoid process. This is the xiphosternal joint. As we mentioned, is a secondary cartilaginous or symphysis joint. Here we have the innermost muscle. We have innermost muscles, and here we have clearly obvious transverse thoracic muscles, and here we will find somewhere here subcostalis muscles. Also, in the rear aspect of the thorax, we will find these are very important structures, which are the internal mammary vessels or internal thoracic vessels. Medially, which one? This is a vein or it is vein or artery? It's a vein. This is a vein. This is the internal thoracic vein or internal mammary vein. Laterally, we will find internal thoracic artery. Regarding the blood supply of the thoracic wall, we can divide the blood supply into anterior part and posterior part. The main blood supply into anterior chest wall is from this artery from the internal thoracic artery. From the internal thoracic, the majority of the anterior intercostal arteries from the internal thoracic artery, and the majority of the blood supply of the posterior wall or the posterior thoracic intercostal arteries are originated from the aorta. Again, the blood supply of the anterior wall from the internal thoracic artery, the posterior intercostal arteries from aorta. We have some variations. For example, there are from the branches from the musculophrenic superficial or superior epigastric, which are branches from internal thoracic. Also, the first intercostal from other areas. So the main blood supply into anterior wall of anterior intercostal arteries from internal thoracic. The main blood supply posteriorly from branches from the aorta. Regarding the venous drainage, also the main venous drainage, venous drainage in the anterior wall will go to the internal mammary vein. Posteriorly, the veins will go to azygous and hemazygous system. They later will go to the superior vena cava. Regarding the innervations, innervation are 12 intercostal nerves originated from the spinal cord. Again, these are body of the sternum in the real specimen. This is a part of manubrium. This is a manubriosternal joint. This is the foid process. This is the transverse thoracic muscles. This is a internal thoracic vein. This is the internal thoracic artery. This is the innermost intercostal muscles. And here we have the internal, and here we have the external intercostal muscles. Anteriorly, these are pectoral regions or chest regions. Here we have pectoralis major. In this area we will find the external intercostal muscles. These are the fats located in the anterior part of the chest. This is the inner aspect of the thoracic wall. This is sternum, this is the body, this is a part of the manubrium. This is the foid process. This is a manubriosternal joint. This is a semisternal joint. This is a rib. This is the intercostal space contains the intercostal muscles. This is the innermost intercostal muscles, and this muscle is the transverse thoracic muscles, one of the innermost muscles. Here we will find somewhere here the subcostalis. Also, in the inner aspect we have this very important structure, the internal thoracic artery. This is internal thoracic or internal mammary artery. Internal thoracic artery is a branch of the subclavian. It's the main arterial supply to the anterior thoracic wall. This internal thoracic veins or internal mammary vein, the main vein is drained to the anterior abdominal wall. Again, this is the rib, the intercostal space, this is the innermost muscles, this is the transverse thoracic, this is the manubrium, this is the body of the sternum, this is the lymphoid process, this is the inner or innermost muscles. Here we will find the internal, and outside we will find the external intercostal muscle. Let us to continue our sessions in the thorax or thoracic regions. Let's move to the lung. This is a lung. This is the right lung. Why it's right lung? Because it contains two fissures. This one is called the oblique fissure, and this one is called the horizontal fissures. Two fissures subdivided the lung into three lobes. This is the upper lobe, this is the middle lobe, and this is the lower lobe. So this is the right lung. It contains again the fissure, horizontal fissure. This is a large one. It's called the oblique fissure. In the lung we have a lot of surfaces. This surface is called costal surface. This surface is called the diaphragmatic surface, and this surface which found medially in the lung is the mediastinal surface. This is again this is a costal surface. This is the diaphragmatic surface inferiorly. This is the mediastinal surface medially. Here the apex of the lung. This is the apex of the lung. This area sometimes the ballura will go above the level of the clavicle. Attached to the lungs we will find the visceral ballura. The visceral ballura. The ballura is the serous membrane that covers the lung. It has two parts. One, the inner one which attached to the lungs is the visceral ballura. The outer one which attaches to the thoracic wall is the thoracic or parietal ballura. The space, the potential space between parietal and visceral is called ballural cavity, usually filled with fluid facilitate the process of respiration. Let's move to the hilum. This area is called hilum, found in the mediastinal surface of the lung. This area, which found superiorly in the right lung, is the bronchus, is the right bronchus. The right bronchus has many features in comparison to the left one. It's short, wide, and vertical, and it's subdivided before it enters the hilum of the lung. Again, the hilum of the lung is the area where structure enter and exit. The roots of the lung is the structure that enter the hilum. So the veins, bronchus, arteries are the roots of the lung, but the area where structure enter and exit is called the hilum of the lung. Again, this is the bronchus, right bronchus. Below the bronchus, we will find the pulmonary trunk or pulmonary artery. Inferiorly and anteriorly, we will find pulmonary vein. Also, we have a lot of impressions in the right lung and in the left lung for esophagus, for aorta, for azygos, for superior vena cava, for. This is the left lung. The left lung is characterized by one fissure, oblique fissure, and two lobes, the superior and inferior lobes. Again, this is the costal surface, this is the diaphragmatic surface, this is the mediastinal surface. In the left lung, we have this area, which is a tongue-like projection, is called the lingula. The lingula is located in the superior lobe, not the inferior lobe. This is the lingula, and this is the impression for the heart, cardiac impressions. This is the hilum of the lung. Here we find the artery. The artery in the left lung is located superior to the bronchus. It's called epibronchus. This is a bronchus, and those are the pulmonary veins. Again, this is the artery, pulmonary artery. This is the bronchus, left bronchus. Those are the pulmonary veins. This is the hilum. Those are the roots of the lungs. Here we will find the impressions of the aorta, impressions of other structures inside the mediastinal surface of the lung. So let's compare between the two lungs. Which one is larger, right or left? Left or right? Which one is larger?
Right.
Is the right lung. Right lung is larger than the left one. Which one is heavier? The right lung is heavier than the left lung. Which one is taller? Usually the left lung is taller than the right lung. Which one is thinner? The left one is thinner than the right lung. Regarding the blood supply of lungs, the lung, like a liver, has a dual or double blood supply from the pulmonary trunk and from the bronchial arteries, which are passes from the aorta usually, bronchial arteries and pulmonary trunk, venous drainage by pulmonary veins. Regarding innervations, usually sympathetic and parasympathetic from the pulmonary plexus. Regarding the functions of the lung has many functions, mainly the organ of respiration, the gas exchange. Also, it has protective function. Also, it plays a role in the maintenance or control of the pH. Also, it acts as a buffer. Also, it contribute in renin, angiotensin, aldosterone system, which is a very important system to maintain the body fluids and electrolyte. This is the right lung. This is the apex of the right lung. This is the base of the right lung. This is the sternal or costal surface. This is the diaphragmatic surface inferiorly, and this is the mediastinal surface of the hilum of the right lung. Those are two fissures. This is called the horizontal fissure, and this is called the oblique fissure. Oblique and horizontal fissure subdivide the lungs, the right lung, into superior lobe, middle lobe, and inferior lobes. In the hilum of the lung, we have here, which found superiorly, the most superior structure is the bronchus. Below it, we will find the pulmonary trunk. Below and anterior, we will find the pulmonary vein. So, what are the structures located in the hilum? Superiorly, bronchus, middle artery, pulmonary artery, and inferior anteriorly are pulmonary veins, pulmonary veins. Here we will find the impressions of other organs. This is the left lung. This is the apex of the left lung. This is the base of the left lung. This is the posterior border. This is the anterior border. This is the oblique fissure. The left lung contains only one oblique fissure. The oblique fissure divides the left lung into superior and inferior lobe. In the inner aspect or the spinal surface, here the cardiac impression. Here we will find the lingula of the lung. Here we will have the lung roots. Superiorly is the artery, pulmonary artery. It's not like the right. In the right lung we will find the bronchus. Superiorly this is called epibronchus. Here the bronchus, and here we will find the veins, the pulmonary veins. This is the cardiac impression. This is impression for aorta, esophagus, and other structures in the mediastinal surface of the lung. So we are going to talk about the heart. The heart is a fist-like shape located in the mediastinum. It has many borders. It has the apex, which is located in the left ventricle. This is the apex of the heart. Let's talk about the heart. The heart is a fist-like shape structure located in the mediastinum. It has many borders, many surfaces. The apex of the heart is located anterior laterally, mainly in the left ventricle. The base is located posteriorly. It's formed mainly by the left atrium. The heart contains 4 chambers. This is the right atrium, and this is the right ventricle. This is the left atrium, and this is the left ventricles. This is the auricles of the left atrium, and this is the auricle of the right atrium. Contain 4 chambers, 2 atria, 2 ventricles. Also contain 4 valves. Valve is the pulmonary the aorta between the left atrium and the aorta is called aortic valve. Between the right ventricles and the pulmonary trunk is called pulmonary valve. Between the right atrium and the right ventricles is called right atrioventricular valve or tricuspid valve. The valve between the left atrium and left ventricles is called left atrioventricular or mitral valve. In the heart we have diaphragmatic surface, we have anterior or sternal surface, we have the base which is located posteriorly, we have right border and we have left border. We must know which part of the heart is formed mainly the diaphragmatic surface. We must know which part of the heart forms the base and other features of the heart. Regarding the internal features of the heart, when we move this part, this is the right atrium and this is the right ventricle, this is the left ventricle, this is the interventricular septum. First, let's start by the right atrium. The right atrium formed by 2 parts, the rough part and the smooth part. The rough part of the atrium contains muscles called pectorate muscles. The pectorate muscles is found in the atrium or atria, not in the ventricles. We have a lot of openings in the right atrium. For example, this is an opening for superior vena cava. This is an opening for inferior vena cava. We have the tricuspid valve opening. We have opening for coronary sinus. We have opening is the embryology is called foramen ovale. After delivery or after the labor in the neonates will become fossa ovale or fossa ovalis. Those are the opening in the right atrium. The right ventricles contains muscles, septal or septomarginal muscles called papillary muscles. Also, we have which muscles called moderator parts. This is the interventricular septum. This is the wall of the left ventricle. The wall of the left ventricle is slightly thicker and larger than the wall of the right ventricles. Also, on the left ventricles, we have papillary muscles, we have septomarginal and we have moderator parts, and we have which called corda tendini, which is a projection, finger-like projection from the papillary muscles to the cusp of the valve. This is the left atrium. The left atrium is found in the base of the heart, as we mentioned previously. It contains the foramen for pulmonary veins, 2 in the right and 2 in the left. Posteriorly in the heart, we have this very important structure between the left atrium and ventricle. The coronary sinus is the main venous traffic for the heart. This is the coronary sinus located posteriorly in the coronary sulcus between the left atrium and ventricles. It's called the coronary sinus. Regarding the blood supply of the heart, the blood supply of the heart is mainly from the right coronary and left coronary arteries. The left coronary arteries will give a lot of branches. One of them and one of the most important arteries in the heart is the left anterior descending artery or anterior interventricular artery. This one is called left anterior descending or LAD. This is one of the most important arteries. Also, this is a common site for ischemic heart disease and MI. Also, the left coronary artery will give other branches like circumflex artery. From the right part, the right aortic sinus, right coronary artery will originate. The right coronary artery will give this branch which will go here towards the apex, called the marginal artery. Posteriorly, we have posterior interventricular artery, which is branched from the right coronary. Also, the right coronary artery will give branches to the SA node, AV node, and other parts of the conductive system. Again, this is the right atrium, this is the auricle of the right atrium, this is the superior vena cava, this is the inferior vena cava, this is the rough part which contains the pectinate muscles, this is the smooth part, this is the auricles of the left atrium, this is the left atrium, this is the coronary sinus, the posterior aspect of the heart, the right ventricle, this is the left ventricle, this is the area for interventricular septum. This is the right atrium from the inside, this is the right ventricle from the inside, this is the space of tricuspid valve, the left ventricle, this is the left atrium, this is the space for mitral valve. Here we have the aortic valve, and here we have the pulmonary valve. In the real specimen, cadaveric specimen, this is the heart, this is the right atrium, and this is the right ventricle, this is a part of the left ventricle. Posteriorly, here we have the left atrium. We have left atrium. Again, this is the right ventricle, this is the auricle of the right atrium, this is the right ventricle, this is the left ventricle, and this is the left atrium. This is the ascending aorta or arch of the aorta. This is the part of superior vena cava which enters the right atrium. This is the opening for inferior vena cava which also enters the right atrium. This is the heart, the structure of the heart. The chambers of the heart are the right atrium, the right ventricle, the left ventricle, and the left atrium. The left atrium. Again, this is the right atrium, the right ventricle, this is the left ventricle, and this is the left atrium. Here we will find the interventricular septum. This is a very important artery associated with vein. This is the anterior interventricular artery associated with great cardiac vein. Anterior interventricular or left anterior descending artery, its other name, associated with great cardiac vein. It's branched from the left coronary artery. Here we will find the right coronary artery will give a lot of branches. SA nodes arteries, AV node arteries, marginal arteries, and posterior interventricular arteries. Posterior interventricular arteries. Here, below the left atrium, we will find the coronary sinus. We will find the coronary sinus. This is the diaphragmatic surface. This is the left atrium located in the posterior aspect or the base of the heart. This is the pulmonary trunk. This is the ascending and the arch of the aorta. Ascending aorta and the beginning of the arch of the aorta. In this session, we will talk about the pericardium and the mediastinum and the pleura and the diaphragm. This is the pericardium, the sac that covers the heart from outer side or external. This is the pericardium. The pericardium subdivided into fibrous part which is located externally and serous part. The serous part has two divisions or two layers. The outer one is called parietal pericardium which is attached to the fibrous, and visceral pericardium which attached to the arc. The space between the visceral and parietal pericardium is called pericardial cavity and usually filled by fluid to facilitate the movement or action of the heart. Regarding the pleura, like pericardium, is a serous membrane that covers the lung externally. The parietal pleura is divided into two parts, into parietal pleura, which attach to the thoracic wall, and visceral pleura, which attach to the lung. The area or the potential space between the parietal pleura and the visceral pleura in the lung is called the pleural cavity. Usually also like pericardial cavity is filled with fluid. The parietal pleura is sensitive to pain, touch and temperature. The inner pleura is not sensitive to pain, touch and temperature. This is the diaphragm. The diaphragm is a musculo-tendinous part that separates between the abdomen and the thoracic cavity. The diaphragm has two domes, left dome here and the right dome here. And in the center we have which called the central tendon. Here we find the central tendon. The diaphragm has many sites of origin: sternal part from the sternum anterior and the process, costal part and lumbar part posteriorly, and the insertion in the central tendon. The action of the diaphragm, when it's contract, it descends downward and act in the process of inspiration. The diaphragm is the main or the chief muscle of inspiration. The motor innervation of the diaphragm by this nerve, which is phrenic nerve. This is phrenic nerve, which originates from the C3, C4, C5, from the cervical regions, and innervate the diaphragm. Motor innervation. Usually, the phrenic nerve is associated with pericardiophrenic vessels. Regarding the motor innervation, regarding the sensory innervation, we have the central part innervated by phrenic nerve and the peripheral part innervated by intercostal nerves. There are a lot of openings in the diaphragm. We can see them from the abdominal part. This one for inferior vena cava. This is the inferior vena cava. The inferior vena cava opening. The inferior vena cava opening usually at the level of T8. This is aortic opening. This is aorta, abdominal aorta. The abdominal aortic opening usually at the level of T12, and we have the esophageal opening. This is stomach, and this is the esophagus, usually at the level of T10. So, inferior vena cava, level of T8, esophageal opening or hiatus at the level of T10, aortic opening at the level of T12. Blood supply of the diaphragm superiorly from superior pericardiophrenic arteries and inferiorly from pericardio or inferior phrenic arteries, which is usually branches from the